Hi, I'm Dr. Gary Motykie, and I am a board-certified Beverly Hills plastic surgeon. One thing I wanted to talk about is, in regards to places like Turkey or anywhere in the world or any surgeons now, is the explosion of social media. And I think there's an interesting study going on out there and different things that people are looking at, and the fact that selfie taking and social media is actually possibly triggering a little body dysmorphia, and patients really starting to self-criticize themselves in the way they look. They're trying to compare themselves to these ideals and everybody else in the world putting these selfies out there. And there is a self-verification theory and a self-esteem theory wherein these kind of social media ideals are triggering patients to seek these surgeries that are ideal but can lead to body dysmorphic tendencies. In other words, there isn't anything wrong with you. You look great. Try not to go too extreme and do too much, because again, that's the point where things can get tricky and a little bit scary. Even I think it was in 2018 or 19, there was something called Snapchat dysphoria, believe it or not. And again, it's all of the use of this social media is leading patients to be comparing themselves to either ideals of patients, which may not actually be ideals, because the other thing that we're seeing with this is filters. We're seeing patients filtering themselves, filtering every photograph they take of themselves, and also these ideal patients that they're trying to live up to are filtering themselves, and they're filtering on top of filtering and trying to achieve this look. And again, I just want patients to know that a good surgeon is going to keep your expectations realistic, and you also want to keep them realistic so that you don't end up chasing something that isn't even real and that can lead to risky outcomes.